Welcome to our video on the anatomy of the muscles of mastication. In this video, we'll explore the muscles of mastication, their anatomy, functions, and clinical significance. The muscles of mastication or masticatory muscles are a group of paired muscles responsible for the movements of the lower jaw at the temporomandibular joints. Therefore, these muscles are positioned within the head and neck around the mentioned joint. The muscles of mastication primarily act during chewing. However, besides the movements associated with eating, they also move the mandible during speaking. Overall, they open and close the mouth. They elevate, depress, protrude or move forward, and retract or pull backward the mandible and provide side-to-side movements. The masticatory muscles can be subdivided into two groups, primary or main and secondary or accessory muscles of mastication. All primary masticatory muscles originate from the bones of the skull and insert onto various features of the mandible. The primary muscles of mastication include four paired muscles that primarily act during eating, enabling such functions as chewing. Each side of the head has the following primary muscles of mastication: Temporalis, Masseter, Lateral Pterygoid, Medial Pterygoid. The accessory muscles of mastication do not serve as muscles that primarily act during chewing, and they include some facial and neck muscles. Buccinator, digastric, stylohyoid, mylohyoid, geniohyoid, sternohyoid, sternothyroid, thyrohyoid, omohyoid. In this tutorial, I will discuss only primary muscles of mastication. Masseter muscle is a paired, strong, thick and rectangular muscle that is originating from the zygomatic arch and extends down to the mandibular angle. It is one of the masticatory muscles. It is divided into two distinct parts. Superficial head, which is larger, originating from the zygomatic arch or cheekbone and inserting into the lateral surface of the mandibular angle. Deep head, which smaller, originating from the deep part of the zygomatic arch and inserting into the upper part of the mandibular ramus and coronoid process. Together, these fibers create a strong, powerful muscle that enables forceful jaw closure. Relations of Masseter muscle. The lateral side off entire superficial aspect of the muscle is covered with thin but very strong masseteric fascia. Also on the superficial side, below the zygomatic process, the duct of the parotid gland passes across the surface of the muscle. This duct courses mostly over the anterior part of the lateral aspect, i.e. it is located anterolaterally. The superficial part of the gland itself is also located superficially to the masseter, but a bit more posteriorly, i.e. posterolaterally to the muscle. Along with the parotid gland, a few more structures can be found over the lateral side of the muscle. These structures are: terminal branches of the facial nerve, facial vein, facial artery, risorius muscle, zygomaticus major muscle. The medial, or inner, surface of the muscle is mostly related ramus of mandible almost completely covering its superficial surface. The medial aspect of the masseter muscle forms the lateral wall of the facial space called the submasseteric space. It is a paired potential space between the lateral aspect of the mandible and medial aspect of the masseter muscle. Located deep to the posterior part of the inner aspect of the muscle, or simply posteromedially, the temporal muscle is found. Anterior to the muscle, the buccinator muscle is located. The above-mentioned duct of the parotid gland actually penetrates the fibers of the buccinator muscle to find its way to the inside of the oral cavity and finally open onto the inner side of the cheek. The posterior aspect of the muscle is located anteriorly to the deep part of the parotid gland. This practically means that the parotid gland surrounds the entire posterior and most of the superficial aspect of the muscle. The masseter is a key muscle of mastication. It causes elevation of the mandible, closes the jaw, allowing for biting and chewing. Its superficial fibers help protraction of the mandible, it push the jaw forward. The deep fibers help pull the jaw backward, results in retrusion of the mandible. Masseter muscle assists in lateral movements, helps move the jaw side to side, aiding in grinding food. Because of its strength, the masseter allows humans to generate a strong bite force, essential for breaking down food before swallowing. The masseter muscle is innervated by the masseteric nerve, which is a branch of the mandibular division of the trigeminal nerve, cranial nerve 5. The masseter muscle receives its blood supply from the masseteric artery, a branch of the maxillary artery, which ensures proper oxygen and nutrient delivery to sustain its function. The superficial part of the masseter receives some blood supply from the facial artery. Clinical significance. Bruxism, teeth grinding. Overuse of the masseter muscle due to chronic teeth grinding can cause pain, muscle hypertrophy, and temporomandibular joint disorders. Masseter hypertrophy. Some individuals develop an enlarged masseter muscle, often due to excessive chewing, bruxism, or even genetic factors. This can lead to a square jaw appearance and may be treated with Botox injections to reduce muscle bulk. TMJ disorders. Dysfunction in the masseter muscle can contribute to jaw pain, clicking, and restricted mouth movement. Mandibular fractures and trauma. Due to its strong attachment to the jawbone, masseter function can be affected in cases of facial trauma or jaw fractures. The temporalis is a wide, fan-shaped muscle located on each side of the skull. This muscle covers most of the temporal bone and fills the temporal fossa. The temporalis is one of the primary muscles of mastication involved in the elevation and retraction of the lower jaw. This muscle is covered by the temporal fascia. The temporalis muscle originates from the temporal plane below the superior temporal line of the parietal bone and the deep surface of the temporal fascia. The temporalis forms a tendon that inserts onto the coronoid process and anterior border of ramus of the mandible. The temporalis muscle plays a key role in jaw movement. Upon contraction it results in elevation of the mandible, closes the mouth or chewing. It retracts the mandible by pulling the jaw backward. It maintains resting tonus, keeps the mouth closed when not chewing. Temporalis muscle assists in side-to-side or lateral movement, thus helps in grinding food with molars. The temporalis muscle is innervated by the deep temporal nerves, which are branches of the mandibular nerve, a division of the trigeminal nerve, cranial nerve 5. The temporalis muscle receives its blood supply from deep temporal arteries, which are branches of the maxillary artery, a major blood supplier to the deep structures of the face. Temporalis also supplied by superficial temporal artery, which supplies the superficial part of the muscle. Clinical relevance. Temporomandibular joint disorders. Overactivity, tension, or spasm in the temporalis muscle can cause jaw pain, headaches, and difficulty chewing. Bruxism, teeth grinding, can overwork the temporalis, leading to muscle fatigue and pain. Temporal headaches. Tension in the temporalis muscle can lead to temporal headaches, often mistaken for migraines. Cosmetic and surgical importance. In cosmetic surgery, changes in temporalis muscle bulk can alter facial aesthetics. In reconstructive surgery, the temporalis muscle can be used for flap reconstruction in facial defects. The lateral pterygoid is a thick and short triangular-shaped muscle located in the infratemporal fossa of the skull. It is classified as one of the primary muscles of mastication. Here is the inferior view of lateral pterygoid muscle. The lateral pterygoid muscle is composed of two heads, superior and inferior. Superior head is smaller and originates from the sphenoid bone. Inferior head is larger and originates from the lateral pterygoid plate. The superior head of the lateral pterygoid originates from the infratemporal surface and crest of the greater wing of the sphenoid. The inferior head of this muscle originates from the lateral surface of the lateral pterygoid plate of the sphenoid bone. The lateral pterygoid muscle inserts on the pterygoid fovea or neck of the mandible. An articular disc and capsule of temporomandibular joint. The superior head primarily controls the stabilization of the temporomandibular joint during jaw movements. The inferior head is the main mover for jaw opening and protrusion. Function of the lateral pterygoid muscle. The lateral pterygoid muscle is the only mastication muscle responsible for jaw opening. Upon bilateral contractions, the lateral pterygoid muscles push the mandible forward or protrude the mandible. It causes depression of the mandible, helps in jaw opening, assisted by gravity and other muscles. It helps in side-to-side movement or lateral excursion, which is important for grinding food during chewing. It stabilizes of the temporomandibular joint, ensures smooth jaw movement. The lateral pterygoid muscle removed here in this diagram, it is innervated by the lateral pterygoid nerve, a branch of the mandibular nerve, which is a division of the trigeminal nerve. The lateral pterygoid muscle receives blood supply from pterygoid branches of the maxillary artery, which is the main blood supplier to the muscle. Ascending palatine artery, which is the branch of facial artery, also provides additional circulation. Clinical relevance. Temporomandibular joint disorders. Overuse, inflammation, or spasm of the lateral pterygoid muscle can cause TMJ pain, jaw clicking, and restricted movement. Tension in the muscle may result in jaw deviation when opening the mouth. Jaw deviation and dysfunction. If one lateral pterygoid muscle is weaker or paralyzed, the jaw will deviate to the affected side when opening the mouth. Bruxism or teeth grinding. Hyperactivity of the lateral pterygoid muscle is often seen in people who grind their teeth, leading to TMJ stress and pain. The medial pterygoid is a thick and quadrilateral-shaped muscle located in the infratemporal fossa of the skull. It is classified as one of the primary muscles of mastication. The medial pterygoid is composed of two heads, superficial and deep. The superficial head of the medial pterygoid muscle originates from the maxillary tuberosity of the maxilla and pyramidal process of the palatine bone. The deep head of the muscle originates from the medial surface of the lateral pterygoid plate of the sphenoid bone. The medial pterygoid inserts on the pterygoid tuberosity of the mandible and medial or inner surface of the mandibular ramus. Upon bilateral contractions, the medial pterygoid muscles push the mandible forward, protrude the mandible. By contracting on one side, the medial pterygoid pushes the mandible to the opposite side. This muscle also contributes to the elevation of the mandible, acting as a synergist to the temporalis and masseter. The medial pterygoid muscle is innervated by the medial pterygoid nerve, a branch of the mandibular division of the trigeminal nerve. The medial pterygoid muscle receives blood supply from pterygoid branches of the maxillary artery, which is its primary source. Facial artery and ascending pharyngeal artery also provide additional blood supply. Clinical relevance. Temporomandibular joint disorders. Overactivity of the medial pterygoid muscle can lead to jaw pain, muscle stiffness, and TMJ dysfunction. Muscle spasms may contribute to restricted jaw movement and painful chewing. Jaw deviation and dysfunction. If one medial pterygoid muscle is weaker or paralyzed, the jaw will deviate to the affected side when closing the mouth. Bruxism or teeth grinding. Hyperactivity of the medial pterygoid muscle is often seen in people who grind their teeth, leading to jaw pain and muscle fatigue. That wraps up our exploration of the muscles of mastication. If you found this video helpful, don't forget to like, share, and subscribe for more detailed anatomy lessons. Thanks for watching, and see you in the next video.